Okay, wonderful. All right. Peace, blessings, enough, holy, plenty, a lot of love to all the kings and queens in the house. I'm glad to see each and every one. And we do welcome everyone to this another wonderful deep dive, globally changing lives. Um, and this time we are going to kick things off and thank you all for being here, for coming, for viewing, whether live on the varied social media platform or sometime in the future. We thank you for joining us. And today we will be having a wonderful guest, very young man. And of course, we'll be having our um, our mindset, of course. But before we do all of that, we are going to be favored with the theme song. This theme song is In It to Win It by our very own Lorato Shadari. Um, very creative, international recording and singing artist. She's on varied stage with other varied, um, you know, important musicians and singing artists, etc., etc. But to start our program, the music um, come from Lirata Shadari, and we thank her very much for giving us this song, which is our theme song here on Deep Dive. And so we are going to be playing In It to Win It. Please take a look and be blessed.
We are here, we are on passive, shining bright into the future. We rise high with one heart and revolution, lifting up humanity as we rise, standing tall, hand in hand. We are the unicorn, we are the stars. Oh, in Your next stop is on passive.
Stand clear of the closing doors, please.
All right, wonderful. Thank you very much, Queen Lerato Shadari. Really appreciate. Welcome once again to those who just coming on. Really appreciate you joining us. And to move right along into our first presentation, yeah, it's none other than our mindset, because mindset is very important in life, not just in on passive alone, but in every facet of life that you can think of. Mindset is very important. And that is why Wall Street persons commit a lot of suicide, because they, they don't have the right mindset. The dollar went down, and oh my goodness, they take it to heart, jump off the building, and commit suicide. Don't make any sense. If you don't have a good mindset in life, then it is problem. And so therefore, to let us understand the different facets of our mindset that we are engaged in, it's none other than our own sweet, lovely Queen Jacqueline Warner. And you'd not believe that this young lady is a grandmother of 9. Don't know, don't know, don't know how that is possible for this young lady. But anyway, she's a grandmother, and of course, she's a international speaker, entrepreneur, and talk show host, and all of those lovely good stuff. And today, she's going to talk about gentlemen and the enlarged prostate. Over to you, Queen Jacqueline Warner.
Platform. Um, Thank you for this amazing platform, Deep Dive, where we dive deep. And I just want to say thank you to all the other leaders, especially Dr. Benny, who always there to support us and educate us and all the good stuff that she does, and all the other leaders that keep us abreast and empower us all the time. And I want to thank the brand ambassadors / affiliates for their support and always showing up. And, thank Ash Mafari for this amazing opportunity that brings us all together. And we got to thank our Heavenly Father for making it all possible. So yes, tonight I'm going to be talking about enlarged, what men needs to know about enlarged prostate. And it's a known fact that lots of men do suffer from enlarged prostate. And not only that, a lot of men don't go to the doctor until a problem, if till something happens or they get some sort of symptoms, and then they find out, okay, I got this and I got that. I remember my own ex, he suffered also from enlarged prostate, and it can turn cancerous. He's still dealing with it. Try to change your diet and different things that you can do. So tonight we're going to talk about what enlarged prostate is actually a benign prostatic hypertrophy. And that's just another name for it, the more medical term for it, actually. And we're going to talk about the symptoms, some of the causes, and some of the things that we can do to help you enlarge, and how to take care of it, how to treat it, and most likely maybe how to also prevent it. So I'm going to start with the symptoms. Pain, the first symptom is pain during urination. I remember my ex, he couldn't go to he would go to the restroom, and sometimes there's no urine, and that used to be so frustrating for him. He wanted to, but he couldn't. And that was an ongoing thing until he went to the doctor. So frequent urination. So you will go to men will go to the restroom, but there won't be no urine, and if it is, it's little drops, and that can be very frustrating, annoying, and a discomfort, you know, and there may be a little discharge also. It becomes harder to urinate, causing you to force the urine. And the outstanding symptom, of course, which one is that? You got to get up at night. And that way you interrupt your sleep, not your rest, but your sleep. So you will get up in the morning, feeling tired, fatigued, and just like, I just want to stay in bed. So it doesn't make you feel good at all. And the causes: the prostate is a donut shaped male reproductive gland, and it sits right under the bladder and surrounds the urinary tube, which is the urethra. The urethra. So muscles located with the prostate squeeze prostatic fluid into the urethral tract during ejaculation. So most of the semen consists of that particular fluid, which provides nourishment and protection for the sperm, actually. So the prostate enlargement is also called a benign prostatic hypertrophy. That means an enlargement of the prostate. So the prostate gland, it gradually becomes bigger. And this occurs in half of all men over 50 and 3/4 of men over 70. It is probably the most common infirmity of the aging in human males. More than 500,000 American men are afflicted each year. It is believed that we age. You think that went? I don't know where that went to. Now, testosterone is really the culprit. The production and the levels decrease, and certain other hormones like prolactin and estradiol, they increase. This results in more of a powerful form of testosterone called dihydrotestosterone in the body. So this hormone causes a overproduction, which is hyperplasia of the prostate cells, which causes the prostate gland to become larger. As it does, it eventually tends to pinch the urethra, and interfere with the flow of the urine. As a result, neither the bladder nor the kidney, they don't empty fully. So there's always urine left behind because the bladder or the kidney is unable to empty all the urine that's in it. So this produces pressure which can damage both the bladder and the kidney. Okay, so urination then becomes more frequent, and the urine flow more slowly. There may be difficulty in starting and stopping the flow. So sometimes there is even blood in the urine. And here is how to check your own prostate. The prostate can be felt or palpitated, actually, with a glove finger. So if you are going to do this effectively, you will need to examine it monthly. A normal prostate is actually firm, like an orange, and about the size of a walnut. You could actually reach into the rectum to carry out this examination. I know a lot of men, they go to the doctor for this examination and they feel so uncomfortable because of how the examination take place. So this is a little to make it a little easier by you self-examination, examining yourself at home, and then when you go to the doctor, you won't feel so uneasy, so the prostate is found at the depth in the rectum that is just comfortably in the reach of your index finger. As an acute case of enlargement may be hard, while the chronic enlargement might be bogey. So tumors, either benign or malignant, tend to be irregular or nodular or nodular. Now, this topic is not about prostatic cancer, but I'm going to mention it a little bit because even though this topic is not about prostatic cancer, I will briefly talk about it. And an enlarged prostate can become cancerous. But fortunately, it always proceeds very, very slowly. So slowly that an operation to remove the prostate due to cancer is generally not needed. Why? This is because before a man is meant to likely die of prostate cancer, as they age, they will actually die of something else first before even that, because of how the prostate it grows, or it grows slowly, slowly, slowly. So it is not like something, oh, I got enlarged prostate, and oh my God, I don't know if it's going to be cancerous or not. You don't even have to worry to that extent, but there is precautions that you should take. Okay. And also a vasectomy. Some men do the vasectomy. I remember my son-in-law, he did it. And for purposes of male sterilization, he didn't want my daughter to go through tubal ligation. So he did a vasectomy, but that has also been linked to prostate disorders and even cancer. I don't know where I went, but I went somewhere. One thing goes, another one comes. Now, there's some natural remedies, and that will consist of diet and other things that can help with enlarged prostate. Number one, your diet. It always boils down somewhat to diet. You have to eat a nourishing diet, including vitamin/mineral supplementation, especially zinc. Men that have prostate issue diets are usually low in essential fatty acids. And the best fatty acid oils to use are the flaxseed oil and the wheat germ oil. Never heat these oils. Now, treat it with zinc. Why? Essentially fatty acid, flaxseed oil, 1 teaspoon 3 times a day, and a high fiber diet, which includes pumpkin seeds and alfalfa. These vitamin A, such as the beta carotene, 300,000 IUs a day, vitamin C to bowel intolerance, and chlorophyll, such as alfalfa. That's what actually alfalfa has chlorophyll in it, and selenium, 250 mcgs, three times a day. Amino acids, which is alanine, glycine, and glutamatic acid, though you can take those in 5 grams each daily for 90 days. And cranberry juice, 2 pints a day. Now, the prostate contains more zinc than any other organ in the body. That's why it was talking about the zinc, because there's a deficiency in zinc. And usually it talks about, I talk about different diseases, and most of the problems comes from deficiency in vitamins and nutrients. So the zinc, you will take 30 milligrams 3 times daily in a highly absorbable form of zinc, which is picolinate or zinc citrate. Then it is recommended that you taper down to 60 and then finally to 30 milligrams daily as symptoms recede. Also take 2 milligrams of copper with every 30 milligrams of zinc, because zinc can cause a copper deficiency. Another area is I don't know why it's keep on slipping out, but take high lignin flaxseed oil. That's 2 tablespoons twice daily amount, along with 400 IUs of vitamin E. And drinking cranberry juice can protect the urinary tract against infection. And that doesn't mean go and buy that cranberry drink that they sell in the store. I think the best bet is buy the cranberries and make your juice from them. That will be your best bet because that cranberry is a cranberry drink. And they said cranberry juice. So there's a difference between juice and drink. Other things you can do is maintain optimal health, like physical and emotional health. And you know what that consists of? And regular exercise outdoors in open air is so important. Sometimes people figure, well, we go to the gym, there's full of AC and you're breathing each other air. That is not, I would not consider that fresh air. But fresh air, walking outdoors is the best. And walking for an hour or two every day is even better. Increase your fluid intake in order to flush the kidneys and bladder of toxins and bacteria. So drinking a lot of fluids, and that don't mean drinking sodas, which is that or energy drinks, so Gatorade and all that stuff that's no good for you, but basically water. And that would consist of distilled water or spring water. Okay. And if you cannot buy distilled water or don't trust with the plastic bottles, buy you the machine. Is very inexpensive, a tabletop, and distill your water and have good alkaline water to drink. And do not allow the bladder to become too full. Urinate as quickly as possible, even when the urge comes. Don't hold on to it unless you have to. You know, sometimes you can see some men doing a little pee pee dance. They need to go to the restroom. Go to the restroom. Try your best to empty the bladder each time. Also, when there is an acute condition, take hot sitz baths daily and add chamomile tea to the water. Also helpful is a short cold bath. Hot and cold plays an important role. If you take a sitz bath, then you can top it off with the cold bath. And we heard Dr. Joseph talk about pumpkin seeds before. Pumpkin seeds have been used for centuries to increase urine flow and help the prostate. So the seeds contain cucurbitacin, which also helps prevent prostate enlargement. They also contain zinc, which is recommended for avoiding enlargement. And pumpkin seed also contains large amounts of the three special amino acids that I mentioned previously, which are the glutamic acid, the glycine, and the alanine. Each of these amino acids are found to reduce enlarged prostate. These are taken in doses of 200 milligrams of each daily. And to increase circulation in the area, you're going to lay flat on your back on the floor, then swing one leg across the other until the knee touches the floor and vice versa. Do it as many times as you can until you get up to 50 repetitions at a time. Other helpful herbs include echinacea and golden seal for bactericidal purposes, and horsetail combined with hydrangea helps contract the prostate. Saw palmetto and cayenne are also helpful. Now, things to avoid: do not eat junk food, fried foods, spices, chocolate, nuts, especially cashews or caffeine products. Do not drink alcohol or use nicotine. Avoid sexual stimulation without a natural conclusion, for example, an orgasm. Continued stimulation leads to a prolonged engorgement. This is not good for the prostate. Keep your mind where it belongs. Do not look at anything hinting a pornographically nature, right? Avoiding everything that is sexually stimulating. Avoid sexual activity as little as possible in the best way to care for your prostate in your older years. Okay. Unless you do have an enlarged prostate, then you will have to take those measures if you experience it at an earlier age. But as an older age, don't try to be, don't get over stimulated. Avoid constipation. That is very important. I remember my ex suffering with constipation the last time we were there on vacation, you know? I was there on vacation. Avoid riding bicycles and motorcycles or horses because they may injure the perineum, okay, which results in congestion of the prostate. And do not sit for hours on padded seats in cold places such as trains and buses, etc. Avoid deep foam chairs whenever possible. Sit on a hard chair. This reduces compression, which especially occurs when sitting in deep foam chairs. So here you have it, men. Some, briefly going over the enlarged prostate, the symptoms. We went over the symptoms. I'm gonna wrap it on up. We went through the causes. There's a decrease of the testosterone, and then the prolactin and the estradiol increases. So too much of the that hormone within the body, overproduction of it, that's what causes actually the enlarged prostate. And of course, the urine flow, it just gets slower, it's become irritable, and this can enlarged prostate can lead to prostatic cancer, you know? So we really got to watch the things we eat to avoid um enlargement is going to happen because of the hormone imbalance. That's why that take place. But once you have an enlarged prostate, these are the diets that you should think of, changing your diet, eating things that more nourishing to the body, not things that will harm the body or make or irritate the prostate or make it more larger or cause it to become malignant, you know. Remember, if there's a zinc deficiency, make sure that you get a lot of zinc from now. So in case later on the if your prostate won't be enlarged because you're already taking care of the deficiency, and learning how to probably balance our hormones is probably the most important thing besides our diet, and also the things that other things that can help. Make sure that you're doing some physical exercise, you know do some walking. You don't have to do nothing drastic or anything like that. Just simple walking does the trick. Make sure we drinking a lot of fluid, a lot of water, because that what gets rid of the toxins. That was get rid of the bacteria too at the same time. Things like pumpkin seed, it's very nutritious, it's very helpful. It has the nutrient that can combat the enlarged prostate. Also, to increase circulation, it talks about laying flat on the floor, doing some throwing your legs over and doing it repeatedly until you get it up to 50 repetitious movements. Also, other they talked about other herbs that is best, echinacea and golden seal. Also, they talk about the horsetail, cayenne and saw palmetto and things to avoid. Stop the junk food. Avoid the sexual stimulation, is especially those of our old men of older age. Avoid constipation. That means you have to eat a high fiber diet so you can move your bowels regularly and not be constipated. Constipation is not good, as that means there's a backup. And they talk about avoiding, bicycles and motorcycles so you don't irritate, cause the prostate to be congested. Okay, and don't about sitting on chairs, all that stuff. You could deep foam chairs, sit on a hard chair. So these are just some things that uh, that bring to your awareness that you'll know a little more about enlarged prostate. You even know learned about the examination and how to even take some of the vitamins and minerals to counteract an enlarged prostate. And And that's basically it for tonight regarding the enlarged prostate. I thank you for your listening ear. I hope this little information was helpful to each and every one of the men on the panel or here on the webinar. And I thank you so much. Back to you, Dr. Derek. That's it. Don't make me laugh. No? No? It's so Thank you so much.
Oh my goodness. um, Good evening. Good evening, Mr. My King Carlton. Thank you so much for coming. I thank you, Dr. Derek, my king. I appreciate you. King Andrew. Aha, King Andrew. Oh, I love that name. Thank you so much. Good evening and good morning, good afternoon to all my queens and kings around the globe. I would say happy Thursday evening to all of us. It's so wonderful to see each and everyone here. I am thrilled to receive you guys here. Thank you all for coming to this amazing deep dive, globally changing life. This is really an amazing webinar that you and we are here. It's really an opportunity for all of us to come here and learn together, grow together. But before I comment, I want to thank our Heavenly Father for bringing each and everyone this evening. A lot of people just lost their lives today, but you and we are here. So we really need to thank God for it. And we want to thank God. We're praying that I just want each and everyone, when you have the time, please let us pray for our CEO, Mr. Ash Mufarel, and his entire family, as well as our newest tech brothers and sisters, and those who are under the weather at the moment. Thank you so much. Queen JW, extraordinary presentation. With this particular topic, it's really important. I wish a lot of people came, or the men came uh, to this webinar. Listening to you uh, is very important. This is a learning environment. I pray that men, please try to go to the doctor. I just went to the doctor Monday. Guess what? My blood pressure was high. 160 over a 90. That was too much. So they said it's because I was afraid. That I was afraid. But it's usually 130. But I don't know why it was 160. Seriously, I don't know. But that is why it's important for us to go to the doctor, because we don't know what is happening with our body. Please, men, women, not I'm not going to only talk about men, but female too. Let's go and check about our own breast cancer. Sorry. Thank you. Yes, I have to do that. I want to thank you so much for this particular topic, because I noticed that the symptoms are not too good, because some of the men, they have trouble uh, to pee, right? And they have weak urine stream, not able to fully empty their bladder. Yes, 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 yes. But please go to the doctor, I beg you. Every year, if you feel any pain, go, I beg you. And if you have to take any medication, make sure that it's been prescribed. Even though sometimes I just bought some medicine now, but I will talk to you later, Queen JW. But I just want to appreciate your topic. And every week you bring different topic. The reason you're bringing this topic is because we need it. The health is very important. Just like Dr. Derek says that the mindset is very important, because our CEO stated that as well. So thank you so much, Queen JW. I do not want to talk too much when it comes to this stuff, when it comes to bladder damage, bladder stones, kidney damage, and all whatnot. But I just want to appreciate you. Thank you. Hey, does anyone else have any question? Oh, thank you, Dr. Derek, for giving me the opportunity.
So, as we said, moving right along into the next presentation. And of course, this is international speaker, board approved NCBTMB. Oh my goodness, that's a lot of alphabet there for one organization. But that is the National Certification Board for therapeutic massage and body work. Continuing education provide in massage therapy, and a clinical massage therapist licensed in New York and also in Connecticut. But even though he's licensed in those two states, he's all over the place. He's in the Caribbean. He's all over the globe. All right. And so he is a creator and the author and copyright um, claimant of muscle fiber methodology, another methodology designed to rehabilitate and relax muscles, and most importantly, prevent muscle imbalances within the body. And so he has a wealth of knowledge with regards to muscle um, methodology, and so muscle fiber methodology. And so, without any further ado, his practical demonstration today, which is clinical muscle fiber manipulation demonstration for carpal tunnel syndrome. And I think that is found somewhere in the hand. I think it's in the hand wrist area. All right. And so, therefore, without any further ado, we present to you King Andrew M Frankson. Over to you, King Andrew.
Muscles when it comes to carpal tunnel syndrome, but my assistant is not well today, but I'm going to go through in details, manipulating on myself, how I would actually do the manipulation. But before going to all of that, what is carpal tunnel syndrome? Carpal tunnel syndrome is the compression of the median nerve that control the movement of the hand, at the wrist. Now, when we grab a lot of stuff, sitting at a desk using a mouse, just holding stuff constantly tend to tighten the muscles in the forearm. So the muscles of the forearm control the movement of the fingers. Every time we grip something, it's called flexion. And with flexion, we shorten the muscles in the hand. Now, the reason why the median nerve gets compressed most of the time, or all the time, is that it's the only nerve that is so superficial in the body. It's right just below the skin. It gets compressed between four bones and the base of the hand. And when the muscles are too tight, it pulls the bones together, compresses the nerve, causes numbness and tingling, weak hands, and pain. Now, sometimes that numbness and tingling might not be carpal tunnel syndrome. That same nerve, called the median nerve, can also be compressed right here in the forearm by a muscle called pronator teres. When the nerve is compressed there, it's called pronator teres syndrome, and it will refer pain to the wrist. Numbness and tingling, weak hands, pain in the hand. So it's good to get a proper diagnosis from your doctor or healthcare practitioner to find out exactly where the compression might be. A lot of us will diagnose ourselves, and we will call everything that creates pain and numbness carpal tunnel syndrome. But we as therapists, healthcare professionals, we need to look at the entire length of the nerve, starting from the neck. And the nerve comes out through the neck between C4 through 7. And that center nerve is called the brachial plexus. Now, the brachial plexus can be compressed anywhere in the neck, causing numbness and tingling down the arm. If we are going to naturally elevate our left hip and left shoulder with that constant shortening or elevation of the shoulder. The muscle that pulls the shoulder up is called levator scapula. And that muscle attaches onto the medial border of the scapula and onto the cervical spine. Now, when the muscle shortens, it might pull on the vertebrae that is attached to, causing compression on that side. Now, if we don't stretch those muscles and lengthen them and get them manipulated, there might be a compression in the nerve or in the neck that causes numbness and tingling down the arm. Sometimes when there's compression on one side, we might develop bulging on the other side. So we need to be mindful of how we take care of our bodies. And the simplest thing that starts happening, you need to think about it, get it checked out before things get worse. Other than being compressed on the cervical spine, it will also be compressed under some muscles right here, just above the collarbone, called the scalenes. Now, when those muscles are tight and because of elevation of the shoulder, it will compress the nerve also, sending numbness and tingling down the arm, all the way down to the wrist. So, as I said, we need to look at the body as a whole because we need to treat the body as a whole. The same nerve can be compressed under the collarbone. This happens when your chest muscles are too tight. So if you have rounded shoulders, forward head posture, means that the chest muscles are pulling on areas where it's attached. So one of those areas is the collarbone, the chest muscle attaches to the bicipital groove, collarbone, and onto the sternum. So opening up the chest, stretching the chest muscle will help to eliminate any compression of the nerve under the collarbone. Another place where the nerve can be compressed is under pec minor. Now, pec minor is attached to the scapula and attached to rib 1, 2, 3. And when the muscle tightens or get tight, it compresses or pushes down onto the brachial plexus that runs under the muscle, crushing it against the rib and causing numbness and tingling down the arm. So all of here can create problem down into the wrist. So we need to be mindful, do we really have carpal tunnel syndrome? And if so, we need to treat more than just the wrist, but from the neck coming all the way down. Another area of concern could be anywhere under the arm, coming down into the hand, where the median nerve compressed on the pronator teres. At both attachments, not even one, the nerve travels under both attachments of pronator teres, and it will refer pain into the wrist. Now, when I'm treating anyone for a diagnosed or suspected carpal tunnel syndrome, I work the entire neck and back muscles accordingly because all muscles are attached when it comes to the upper body. One thing always impacts the other. So we want to relax the entire back, neck, and arms. So when we're working the muscles of the neck, we're actually trying to spread the fibers of all the neck muscles, SCM, upper traps, scalenes, to loosen up everything inside here so that we can encourage the muscles to lengthen and relax. Once the muscles lengthen and relax, it will reduce any compression or tight muscles in the neck, which might be pulling on the cervical spine. Next thing I would do then is massage the chest muscles. Once we loosen the pec major, we'll be able to get down to pec minor much easier to manipulate that muscle. And with all of this, there's no pain. Now, for women, breast tissue normally comes in play, but with proper draping, we're still able to work the chest muscle above the breast tissue and still get down to pec minor in order to lengthen and manipulate the muscle. Now, one of the key things about my type of work is that I manipulate muscles according to its action.
Right. My apologies, everyone. Really appreciate we jumping back on board. Unfortunately, where is it? All right, wonderful. All right, do apologize. Unfortunately, Dr. John kind of clicked the wrong link and kind of mess up everything. Do apologize for that. And thank you all very much for joining us once again. And just give it two, okay, almost. All right. So do apologize. And King Andrew Frankson will continue with his presentation. Over to you, King Andrew.
Yes, thanks for getting back. We were discussing the different areas where the nerves can be compressed, coming through the neck, the scalings, under the collarbone, pec minor, coronary teres, down into the wrist. Then we're moving into how with muscle fiber manipulation, how we would treat the nerve compression from the neck all the way down to the wrist, which will include the back also, because anything that happens into the back impacts the neck and shoulder. So we start back with the neck, where we would try and manipulate levator scapula, which is this muscle here that elevates the scapula, lifting it up and bringing the cervical spine towards it. Now we want to lengthen all of that, so we do that with passive stretches. Then we manipulate the levator scapula, the upper trap muscles, and the MCM, the muscle at front of the neck. All those muscles will tighten because of how we use our body, because we have a dominant side. If we have trauma, healing from even a stub toe can trigger tightness in the neck, which can cause numbness and tingling down the arm, and either mimic or create carpal tunnel syndrome. Next thing we'll be working is the chest muscles. The chest muscles attached to the collarbone, bicipital groove, and the sternum. Now, how we'll manipulate the muscle, what I would do is manipulate the muscle in the different actions of the muscles. Each muscle has different fibers that does different action. So I will move the arm in different position and manipulate the muscle fibers accordingly. Now, when we're in this position, these fibers that run this way gets manipulated and softened quicker. Just moving the arm in a 45-degree, then a 90, we stretch and shorten different muscles and manipulate them accordingly. And once we get the pecs all loose, then we're able to get down to pec minor, to loosen pec minor that will be compressing the nerve, pushing it against the ribs. So loosening up all of these muscles here is important in helping what is going on in the hand. And as I said, for a female, we would work above the breast tissue, not going anywhere down, compressing any breast tissue at any time. So we're going to, with proper draping, we can work the muscles along the sternum into the bicipital groove and onto the collarbone without impacting breast tissue at any time. Next, I'll do is manipulate all the muscles of the shoulder, biceps, triceps, loosening those muscles also. Now, the main problem area is another one is pronator teres. Now, to manipulate the forearm muscles, which everything at the front here are flexors, so we want to make sure that we lengthen and spread the fibers. But when the fibers get tight, they stick together and they create a lot of problems. So onto the forearm, we want to spread all the fibers of these muscles. Pronator teres is this little muscle right here that compresses the nerve, causing numbness and tingling. So what I would do is spread the muscle fibers in one direction from the elbow all the way down to the wrist. And then moving up in the same direction, ending where I've started. What I do next, I go into the opposite direction, getting all the fibers that I missed to make sure we spread and flatten all the muscle fibers from elbow to wrist and back up to the elbow crease. Then from here, I would just stretch the muscle in one direction, so 2 to 3 times, and then stretch the muscles back in the opposite direction 2 to 3 times. Now, one of the most important thing about the methodology, because we are manipulating the muscles in more than one action, because the muscles here at the front here are flexors, they grab things, make a fist, hold your mouse, hold onto your handbag when you're on the train or anything like that. We want to manipulate the muscles when it's short. So we'll have the client make a soft fist, and the same actions I just showed you would manipulate the fibers while the muscles are short, because making a fist shortens the muscle. Then we want to manipulate the muscles when the hand is in neutral, that is straight. Same thing going over the fibers, same actions that I just showed you, back up, other direction, and stretch. And the last thing I want to do is put the muscles in stretch, which means taking the hand back, creating lengthening all these muscles. And then I manipulate the muscles again while the muscles are in stretch. Now, because we work the muscles like that, I never have to work deep. There is no pain when it comes to muscle fiber methodology. There's pressure, but no pain. Just enough pressure to feel the muscles under your fingertip. And that's a simple way of manipulating these muscles. Next thing we do, we want to open up the palm. So we grab either side of the palm and pull out to create a stretch. And that will help to open up the space so that we increase the space for the median nerve, taking the pressure off the nerve so that it will reduce numbness and tingling and weakness in the hand. So bear in mind that although we're feeling numbness and tingling, weakness in the hand, pain in the wrist, it doesn't mean it's carpal tunnel syndrome. Compression can be anywhere along the line from the neck all the way down to the arm. And everything should be treated accordingly. So if you're diagnosed with carpal tunnel syndrome, I would recommend that you find a good therapist first before trying to get an operation done. Some operations have been successful. There's one where they go in and they make the space bigger for the nerve. But the easiest way is to open up and spread the arm hands, and that will take the bones away from the nerve. The other operation, I'm told they cut the tendon right here to release the nerve by giving it space. Now, the problem with that surgery is that that tendon that wraps across here holds these four bones together. So once that tendon is cut, the possibility exists that those bones can shift. And eventually they will push on the nerve if the shift happens. And then you have a compression for the rest of your life. So be mindful in rushing to get an operation. Try everything else first, especially stretching and manipulation of the muscles. Now, a lot of us don't like to be touched. So in cases like those, I will work with my clients with my shockwave machine or do passive stretching. And there's an active stretch that I recommend for a lot of my clients that have carpal tunnel syndrome or numbness and tingling. In order to stretch the forearm muscles and to open the wrist, I give them what I call the prayer stretch. So the stretch involves you putting your hands together, palm flat, fingers open. You're going to take your thumb to your body as low as possible without rounding your shoulders. And you're going to keep the palms flat together for about 5-10 seconds. Then from there, you want to roll, taking the little fingers now to your body without separating the palm, holding that there for another 5-10 seconds. And you can do that about 3 times, rolling it back up slowly. In each angle, each position stretches different fibers of the same muscles. So you're stretching all the hip flexors by taking your palm into extension. Rolling it back down to the little finger. My hand is still against my body. Hold for another 5-10 seconds. And then I relax. And that's a simple active stretch to stretch all these muscles that will help to eliminate numbness and tingling in your wrist. Compression of the nerve by pronator teres. It will also help to loosen the muscles that are attached on the medial epicondyle and the lateral epicondyle, which when muscles are also tight in these areas, you can develop golfer's elbow or tennis elbow accordingly. So be mindful in stretching, get your muscles worked on. Don't diagnose yourself. Speak to a professional, speak to your doctor. If not, go find your massage therapist and have them manipulate the muscles for you, which would be much easier. Or the combination of being stretched or you stretching the muscles and getting the muscles manipulated can help a lot with any numbness or tingling down the arm. So carpal tunnel syndrome, or I should say numbness and tingling in the arm, can be helped with manipulation. So don't be afraid to go out, get those work done. Don't diagnose yourself. Speak to a professional. There's a lot of other problems in the body that can trigger tightness in the neck, shoulder, that can cause that problem. A good massage therapist or clinical massage therapist will look at your body on a whole to determine what might be triggering a problem somewhere else. So as I say, if you stub your big toe about 10 years ago, 20 years ago, you will create a holding pattern. So if you stub your right toe, let's make it the left toe. You stub your left toe, you're going to naturally elevate your left hip. So if you're right-handed, you're going to have an elevated left hip, elevated right shoulder, and the possibility exists you might develop scoliosis. And with that, because of the elevated right shoulder, you might start feeling numbness and tingling down the arm. So looking at the body as a whole is important in creating treatment patterns when you see a massage therapist. So don't just go in and ask for a massage or relaxing massage. Let the therapist know exactly what's going on. And if the therapist is not in a position to make an assessment, they may refer you to the doctor to get a proper diagnosis. So be mindful of how you use your body. Gently pull your abs in, help to realign your posture. It will help to keep your shoulders down. And with that, it will eliminate numbness and tingling down the arm that might trigger carpal tunnel syndrome or pronator teres syndrome, pain in the wrist. Okay? Any questions? Mr. Faust. I could go on and talk about a lot of other stuff. Well, until then, come on, let's talk about it. So depending on how we use our body, we all have hip problems. Every one of us. If you're right-handed, right hip is going to be elevated and back, creating an anterior tilt on the right side. Left hip is going to be forward and down, creating a posterior tilt on the left side, compressing the deep butt muscles of the hip. Once there's that problem happen, the hip, one hip is going to be higher than the other, which is going to create a lot of problem, back pain, hip pain, hamstrings on one side are going to be tighter than the other, and a whole host of problems. So be mindful of how you use your body. When you sit, try and sit with your knees straight. The more we sit with our knees apart, the more we shorten the muscles of the hip, creating problems in the hip. Sciatica, aka piriformis syndrome, and all those wonderful things that we do not want to happen. So a good way to practice proper posture is just to gently pull your abs in when sitting down. Do not pull your shoulders back. Just pull your abs in slightly, still breathing through your nose. Once you pull your abs in, your chest naturally rises, your shoulder naturally falls back and down, just by pulling your abs in. So it's another way of staying away from back pain, carpal tunnel syndrome, and hip problems, just by using this effectively. So if you have a six pack and you're not using it correctly, you still will have a bad back. Still will have one hip higher than the other, which a lot of the time that leads to a short leg syndrome. Because if you weren't born with a short leg, the possibility exists is that the muscle in your low back is creating the problem. It's actually lifting that pelvis, which takes the hip and that leg higher, creating a short leg. One of the hosts wants me to go on and on. I'm not sure. I was finished that carpal tunnel syndrome. I didn't hear you, so I just went on and showed us some other
Okay,
stuff.
well,
How to
I
use
kind
the
of
hands to
I
protect.
okay, okay. I didn't know,
No
because
problem with that.
normally they would say, something to indicate that they finished, but
Oh
I
man,
didn't
that's
get that.
my apologies.
All right, cool. No problem, man. We might have to invite you back again because it seems as if you have a lot of info. All right, thank you very much, King Andrew Frankson. Really appreciate. It's awesome. That presentation. Really apologize for the break in transmission to everyone and those on the YouTube. But some technical difficulties went on, and we do apologize. But thank you very much, King Andrew. That presentation was awesome, and really appreciate. You have a wealth of knowledge as to where muscles are concerned, because a lot of people don't understand that muscles is what really hold up the body. Because yes, you have the bones, but if the muscles is not round the bones and working properly, why my question is, why people believe that it is age let them less and less functionable.
See, people have been using that excuse for to justify being inactive, to justify pain. When a lot of it is just that they just stop using their body. It has nothing to do with age. The more you use it, the more it stays the way it should be. If you don't use it, you lose it. There's nothing to do with age because there are seniors that are still running sprints at the pen relay. You'll be surprised at these older gentlemen darting down the field. And there's nothing to do with it. It's how you take care of your body, how you use it. Lack of use creates problem in the body. Overuse also creates problem in the body. So you have to balance how the muscles work, how you use your body on a regular basis.
Mm-hmm. Beautiful. Wonderful. Thank you very much, King Andrew. Really appreciate. Really appreciate. Any questions, any comment? Let me turn it over to First Lady Queen Dr. Benny, as she hosts the question and discussion. Over to you, First Lady Queen Dr. Benny.
Certainly. Thank you so much. Thank you so much, King Andrew. I really appreciate your presentation. I would say astonishing presentation. I mean, because you are well versed when it comes to our muscles. Before I ask you any question, I just want to find out from my brand ambassadors. Do you guys have any comments or question, please, regarding this presentation? If you could please raise your hands electronically, or you can write your question on the chat. I'll be able to read it to him. Thank you so much. Even Queen JW. Oh, she's trying to unmute herself. Let me see. Unmute. Go ahead. Unmute.
I just want to say amazing presentation. It help us to understand more and how to help ourselves before we experience some of these ailments and how to correct and balance our life when it comes to our health. So thanks. Appreciate you.
No problem, anytime.
King Andrew, thank you so much, Queen JW. I thank you for your support. Thank you for your love. within this amazing company. King Andrew, I found out that women experience a rapid decline in their muscles mass when it comes to post menopause, but men have more gradual decline in their muscle mass during and after when they are 40 years at 40s, in their 40s, which means that most of the people age and they have a higher number of slow twist muscle fibers. Why is it that women they experience rapid decline of their muscles? I mean, because of their getting older for menopause, right? I mean, why should it be?
Well, as I said before, well, during certain time in our lives, we like menopause. A lot of women think there is the time to slow down and just go through the motions. So once we stop using our bodies effectively, we're not actually maintaining the muscle mass that they normally had, if they had it in the first place. So being active must like doing strength training is a good way of maintaining muscle mass. Men who lose it, the same thing. In their 40s, they get complacent, they get relaxed, they slow down, and they lose muscle mass accordingly. We have to maintain um, the muscle's integrity by constantly keeping the muscle strong. And not just strong, we need to keep the entire muscle strong because we tend to use our bodies one way.
Oh.
And what that does, it fires certain fibers in a muscle more than others. And that can create an imbalance within a muscle. So actively working out, walking, running, whatever, swimming is even wonderful. Okay. If you don't like to do none of those, in the Caribbean, you go to your carnival dance or get out. Just use the body. We get complacent, we stop doing stuff, we get relaxed, the muscles get flattened, and that is where things go downhill when it comes to that. So this is where your trainer comes in, speak to your doctor about what might be good for you, get your regular checkup, get your heart health to know what kind of exercise routine that you can actually take part in. But consult your doctor and keep moving. That's all I would say.
Thank you so much. So, when you talk about using your body, um, is it by exercising or getting up in the morning, but not just staying at home relaxing? You have to go out there and do something. Is that what you mean?
Yes, go out there, do something. If it's in the areas where, like here in New York, there's a lot of snow and it's cold, I will do exercise in my bed before I even get up. I can do my abs in my bed. I can stretch my muscles while still lying on my back. A lot of people have tight muscles from sitting down. So a good way of stretching your calf muscles, lying on your back with your legs straight, and just bring your toes towards your knees. Simple that stretches your calf muscle. And because the calf muscle crosses the knee joint, it also impacts your hamstrings, putting a light stretch in your hamstrings also. When people get up in the morning and it's hard to move, it's because there's not enough blood in the muscle during that time. So without blood in the muscles do not contract effectively. So movement is flowing. After a while, when it starts moving, then everything starts moving better. We just confirm that getting blood to the muscles is essential. So before you jump up, you just rotate your foot at the ankle, and you will have the heart start pumping blood all the way down through your quads, hamstrings, down to your calf muscles, down to your foot. So by the time you get off the bed to stand up, you move more efficiently. So you can actually start your workouts in bed. You can move your arms to different positions, right on the bed, open up the chest, move your shoulders just like exactly. You lie on your back, take your nose to one armpit, stretching the muscles in your neck. Now, depending on how you slept the night before, if you sleep on your side, you might have tightness in the neck. So lie on your back, move the pillow, and take your nose to your armpit, stretching the muscles at the back. Other one can take your head up in different angles and stretch all the muscles before you actually jump out of bed. So you can exercise in your bed. You can do a lot in your bed before you get up.
Thank you, King Andrew. Now you're talking about like laying down straight. I have
Yes.
an individual who is also a brand ambassador. He has been in the hospital, let me say, nursing home plus hospital, 2 good years. So he has swollen feet. The 2 legs are swollen and he cannot move. So are you telling me that the blood is not flowing?
Back to the heart.
What?
Yes. Without movement of the foot, the blood will tend to pool. So the heart pumps the blood out through the arteries, to the appendages, throughout the body. For blood to get back to the heart, there has to be movement. So if somebody can rotate his foot at the ankle, it might encourage blood flow back to the heart. If the person can just gently move their foot around in a circle both directions, that can trigger venous flow back to the heart, which might help with the swelling in the leg.
Wow. Um, so do we need well, people like you to I mean, can you help that individual? I'm just giving an example. I wish the unfortunate thing is that you're in New York. He is in a suburban hospital. So he was in the nursing home and they did not treat him well. So something happened that he went to the hospital. Now, when it was time to take him back to that nursing home, he refused. He told them that he's not going back because of the way they maltreated him. And since then, it has been 1 good year that that man is in the hospital, at suburban hospital, just laying down, just like this. Then I asked him, why is it that he cannot get up? Why is it that the nurses cannot like put him on the chair? Let's give an example that if you were there, do you think you can help him to get better?
First thing I do is speak to his doctor, because there might be other underlying issues going on why they have not moved him. So all of that would have to be related to or from the doctor first before even touching. I would have to know exactly what is going on with him. There could be other blockages that they are afraid to move him for blockages to move and create a stroke or whatever. So first thing I'll do is speak to his doctor to find exactly what is happening before I touch him.
Actually, first of all, you are correct. Stating that stroke. Yes, he something happened that he stopped eating because his wife told him to leave. So he stopped eating and he fell down. That's when he had that stroke. And up to today, he has that swollen feet. I didn't know. I was just trying to find out a way how we can help him.
I'll just say, it's best to speak to the doctor first to find out what's going on. Because if any therapist go and start working on him without knowing what the other problems are, and maybe dislodge something in a vein or artery, and he has a heart attack, another stroke, then that therapist can be liable. So I'll contact the doctor first.
Oh my goodness. Thank you. I mean, he is there with a doctor. I don't understand. They are not really taking care of him. Ah, even though he's just praying. Yeah, that's all he's doing right now. Because left leg, left leg and the arm. It's not working. It's just only his right hand that he's using to eat and using just to call somebody. Nothing else he can do. But thank you so much. You make me to understand that the blood is not flowing down his legs. Hmm. Thank you so much for your knowledge. I appreciate you.
No problem. Yeah, he would need a physiotherapist to help him to start moving, combined with manipulation depending. So for him, the manipulation would be more of trying to prevent other muscle imbalances from happening. While physiotherapy will be working on physiotherapists will be working on the strengthening aspect. And then both therapists would have to, as I said, they have to speak to the doctor and work according to the doctor's diagnosis.
Thank you so much for your knowledge. Queen Teda King says, yes, King Andrew, so true. I do that each morning, twist my ankles and toes before getting up. Wow, I'm learning something. Uh, thanks for your very informative presentation. And for Queen JW, excellent mindset. Unfortunately, not many men were on. They were on to listen. Hope they will listen to the replay. Thanks again for your dedication each week. I really appreciate you all. Let me just check again whether I can see anyone. Queen Teda King, thank you so much for this amazing message. You know, with this message, you're making each and everyone to say, okay, at least I came here and I presented, and at least people enjoy it. That will motivate them to come back next week with another topic when it comes to the health and when it comes to this, our muscles. Thank you so much. King Andrew, you said so that all muscles are together, right?
They're connected somehow, yes.
They're connected together. Hmm. So, which muscles is the biggest one?
The biggest muscle. It all depends on the body. Glute max can be big on a lot of people, which is your butt muscle, the one that is extended. That's the glute max.
Wait, your buttocks, my
Yep,
buttocks.
yep.
Ah.
That's glute maximus. Chest muscles on some men can be massive. So it all depends on how you're designed, because everybody is designed differently. Okay, so some people would say the glutes, some people say the biceps or the chest or the deltoid. It all depends on how you're designed, how God made you, and how you built that body up. But most of the time, the glutes well, not a lot of the glutes that you see now is real, but most of the glutes are the bigger muscles in the body.
Well, you know, you're very smart. See, why do I say you're very smart? I went there and asked the question myself. I said, which muscle is big? It says the gluteus maximus is the largest muscles in the human body by mass.
Yep.
So I didn't know that my
Bear in mind, some people don't have big glutes, so for their body, it will be something else.
oh oh okay, wait. So this you have big men like this, those with big belly. Hmm. Isn't their belly? Wait, hold on. I'm trying to find out. Okay, men. Well, I know that women have big belly because they have babies. Now, men, they have big belly. They don't have babies. So with that belly, the big belly like this, doesn't it contain that muscles?
The fat is on the muscle.
Oh. Okay.
The fat is on the muscle, and for a lot of men, it's hard to burn that fat because they do certain exercises that might not be good for their body, or it doesn't work in burning the fat from there. Then there are other men with they have a barrel chest, which means their rib cage is high, so they will tend to have more of an extended stomach most of the time because the organs tend to fill up that area, and they might look as if they have a big belly, but it could be just because of their shape, their design. But then men with extended stomachs, most of the time that is fat, that can lead to diabetes, high blood pressure, hypertension, all kind of sicknesses that they need to stay far away from if they want to live long enough. Like the woman. The women tend to live long even if they have
Big belly.
fat in their belly. Yeah, even if they have a big belly. So also men need to be careful about that part.
So I have one guy at my job. So I noticed that these muscles, they're so big. So this is how he walks around. Why is there, I mean, by him, why is it that, well, I know I'm supposed to ask him, right? Why is it that he's building only his, what, this is bicep, right?
Yep, biceps.
Ah,
Yeah, so it's the biceps and triceps that I am. It all depends on what people think is good for them.
yeah.
People think a massive upper body is what looks good, and then there are others who think of massive legs and a smaller top, and they have those that they're just massive all over. So it all depends on what appeals to them. So maybe he has seen somebody like that, a Schwarzenegger, but well, Schwarzenegger is rounded. But maybe I've seen somebody else like that he admires and wants to be like that. So to each his own. To each his own.
So what I noticed that he eats every 2 o'clock. He does not eat at 12, but at 2 with a small bowl of rice and meat. That's it. Nothing else.
There's a diet plan that to maintain a certain size.
Oh.
They all have a diet that they work with. Their trainers or coaches might have them on a certain diet to maintain a certain body mass, build muscle, maintain a certain weight. So it's not matter to each his own, but a lot of the men who are like this, they tend to have very short bicep muscles.
Okay.
The best biceps to look at, in my opinion, is where the muscle starts at the elbow crease and comes all the way up here. If it's just a little rounded thing where it forces the hand to look like this,
Yeah.
then the biceps will be too short. And most of these muscles are just slow muscles because of the shortness of the muscle. It's not as strong as it should be. A longer muscle is a stronger muscle.
Okay. Thank you. I'm here looking at my own arm. I appreciate you so much. Dr. Doris says, anyway, she was just commenting, men have pot belly. Thank you so much, King Andrew. We appreciate you. And I know that next week you have something else. Well, I'm not pushing you to come back next week, but and I mean, because you are very knowledgeable, I want to thank you for instilling knowledge into us when it comes to these muscles. You're making me now to at least try to exercise myself, my neck, right?
Mm-hmm.
Thank you. Thank you for your time.
Anytime, anytime.
King Dr. Derek, are you available, please? For the
Okay, thank you very much, King Andrew and First Lady Queen Dr. Benny. Really appreciate. And of course, thank you very much, Queen Jacqueline Warner. And at this time, we are going to ask Queen Jacqueline Warner for her final comment.
Thank you so much, Dr. Derek. And thank you to all the brand ambassadors slash affiliates, and also to all Dr. Benny, the host with the most. Thank you so much for always embracing us with your knowledge and your love. Because you know you always say, "Did anybody tell you that they love you?" And you say, "I do." So thanks. I mean, enlarged prostate, like we learned this evening, even though it's not a lot of men under, but the ladies could pass it on, and the men that's on the webinar can pass it on to friends. Share it with other men and let them know how important it is that we do get our yearly physical, and that we do use the technique of examining your own prostate, in a sense where you will know if there's something wrong before you have to get a symptoms like, um lack of lack of urination, or you got a force, or something is going on. I'm not sure what's going on. You're constipated. There could be so many other symptoms besides the ones that I listed out to you or brought to your attention. But the best thing to do is watch what you eat. Always, I don't know if you can ask your physician if you could take a hormone um, test to see where the hormonal balance is within the body itself, because there is an imbalance, and the only time we find out that there is an imbalance is when something goes wrong, and still at that same time they don't exactly say it's a hormone imbalance. So we need to stay on, exercise, drink a lot of fluids to flush the toxins and the bacteria out of the system, and watch what we eat. Read or go back again to reading your labels, but enlarge, like I said, doesn't come from your diet per se until it becomes a problem. That's the time when you will have to pay attention to what you eat and what you drink. But besides that, we should always be paying attention to what we eat and what we drink. And enlarged process can turn out to be cancerous or just cause some other issues. But like I said, it's mostly in men from 50 to 70 years of age. And the statistics show that there's 500 American men that suffer from this prostate issues or disorder. So it just make, I think for men that they should always pay attention to their bodies, not because they're not women and they don't have children, they don't bear children, that they shouldn't pay attention to their bodies, but they should. Because like Dr. Benny was saying, some men has large tummies, and that is not healthy. Like King Andrew brought to, you could get diabetes, but also they said the measurement of your waist can determine if you're going to have heart attacks. So it's very important that you stay fit. We need to walk. Walk. It's not hard. It's so simple. Make time for you. At the end of the day, it's going to boil down to you anyway. When the doctors say they can't do no more, it's on you. When you get sick, it's on you. When you got to pay the bills, it's on you. So why not take care of you when you can take care of you? So I just thank y'all for your listening ear. I hope this information, that you could be able to pass it on to others. It brings awareness. That's what it does. It brings awareness. It gets you to know a little more because the doctor doesn't have time out of his busy schedule to sit down and explain everything to you. Sometimes they might give you a pamphlet, and that's not all the time, So research, the things that affects you. Do research, find out. Just don't be a sitting duck, So let's take care of our health, let's stay focused, and let's continue to empower and uplift each other. So thank you so much and enjoy the rest of the webinar.
All right, wonderful. Thank you very much, Queen
You're
Jacqueline
welcome.
Warner. Your final comment, King Andrew.
Well, both male, female, use it or lose it. Exercise, any form of exercise, swimming, strength training to maintain muscle mass, proper diet. Um, Start doing simple stretches, subtle stretches, any kind of stretches to lengthen the muscles. That will also help to eliminate or keep away carpal tunnel syndrome. Simple stretching of the forearm muscles on a regular basis. All that will help. So use it or lose it. That's my main thing right now. Use it or lose it.
All right, thank you very much, King Andrew. Frankson, really appreciate. And of course, thank you very much, Queen Jacqueline Warner. Thank you very much, everyone, making it deep dive. Really appreciate everyone coming and staying on, even though we had a little technical difficulty today. All right, but remember, we are heading into the weekend. For some people, there's some snowstorm. For some people, there might be heat wave. But just keep dry, keep hydrated, and exercise. We want to let you remember that each weekday at 1 p.m. Eastern, we have the Yvonne Duo, which is Queen Dr. Yvonne and Queen Yvonne Finn, every weekday, and that is one global movement. We also have on Sunday coming, which is the Dream Team, 1 p.m. Eastern Standard Time, and it will be fireside chat with Michael Williams Aim. Mondays, it's Miriam Edwards with Mindset Monday, and Tuesdays and Thursdays, it's Deep Dive. Thursday morning, 8 a.m. Eastern, we have O Passion, Singapore and Malaysia, and on Wednesday, there is Julie Pierre empowering humanity. Please remember these webinar. If you can jump on, and keep the mind fresh with information. Information cannot kill. Information is good to have, and especially good information. And so we thank Queen Jacqueline Warner and King Andrew Frankson for those two wonderful presentations. Thank you very much, persons on YouTube, for joining us today and making it deep dive, globally changing lives. We are going to move over into our after party because, as you know, work and no play, Jill and Jack, dull. We don't want anyone to be dull, and so therefore we are signing off with YouTube, and we are continuing for a few minutes with our after party. Thank you very much, and you do have a wonderful, safe, productive weekend. Weekend.